When you find a person who appears to be unconscious, follow the emergency action steps. Check, call, care. Check the scene for safety. For a child, obtain consent from a parent or guardian if present. Then check the person for responsiveness. If the person doesn't respond, call for help. If the person is face down, gently roll the person face up, keeping the head, neck, and back in a straight line so you can provide care. Once the person is on her back, open the airway by using the head tilt, chin lift technique. To perform the head tilt, chin lift technique, place one hand on the forehead and 2 fingers on the bony part of the chin. Then tilt the head back as you lift up on the chin. Maintain this position. For a child, do not tilt the head back as far as you would for an adult. Check for breathing for no more than 10 seconds. Look to see if the person's chest clearly rises and falls. Listen for escaping air from the mouth and nose. Feel for escaping air against the side of your face. Normal, effective breathing is quiet, regular, and effortless. In an unconscious adult, you may detect an irregular, gasping, or shallow breath. This is known as an agonal breath. Do not confuse this with effective breathing. Care for the person as if there is no breathing at all. If an adult is not breathing, quickly check for severe bleeding, then begin chest compressions. If a child is not breathing, give 2 rescue breaths, one after the other, before checking for bleeding and giving care for the conditions you find. Use a CPR breathing barrier if available. Tilt the head back and lift the chin up. Then pinch the nose shut and make a complete seal over the child's mouth. Blow gently for about 1 second. Each breath should make the chest clearly rise. If the chest does not rise, re-tilt the child's head and try another rescue breath. After 2 successful rescue breaths, quickly scan the body for severe bleeding and care for the conditions you find. If at any time an unconscious person begins vomiting, the airway could become blocked. Roll the person onto one side, and then use a finger to clear out the mouth. Once the mouth is clear, continue to provide care based on the conditions you find. If the person is unconscious but breathing, maintain an open airway with the head tilt, chin lift technique, and monitor breathing and for any changes in condition until EMS personnel take over. If you cannot maintain an open and clear airway because of fluids or vomit, place the person in a modified Haynes recovery position by moving the person to her side while keeping the head, neck, and back in a straight line with the knees bent. If you need to leave the scene to call 911, modify this position by tucking the hand under the head.